Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. So our group are going to present about pedophilia. So these are our group members. We are all 9 and my name is Nur Maisarah Nur Azmain. So what is pedophilia? Pedophilia is defined as an adult sexual attraction to prepubescent children and seems to have different arousal patterns from hebephilia, which is the sexual response to pubescent children as reflected by one's sexual fantasies, urges, thoughts, arousal, or behavior. In its clearest expression, the individual sexually prefers children and has no sexual interest in adults. In other cases, the individual is sexually attracted to children but also has sexual fantasies, urges, etc. regarding adults.
Hi and Assalamualaikum. My name is Siti Mufaidus binti Muhammad Nasir. Okay, let's move to the slide. Prevalence. The research was taken outside from the Malaysia. Usually, pedophiles age mostly between 16 years old and above, or at least 5 years older than the child. From one research article, the prevalence can reach up 3% until 5% when general fantasy are included to be investigated. This is one of the kind example when male have fantasy about sex with the child. This will make them have higher probability to do sex, even though they are only fantasy about that situation. A true or real pedophile is 1% not include the fantasy that they have to the child. From other researchers, like study case indicate that female pedophile also exist, even though in minor. Many people do not know their existence and assume only male pedophile was exist. Okay. For example, female teacher being sentenced in a year in prison because guilty of sexual intercourse with a child in 2016. This happened outside from Malaysia. Okay. From point of view from the victims, from the detailed research that taken by Canadian study, they take a sample which is 750 women and 750 men, which same unit to make sure to see the differences. The result found that 32% women and 15.6% men had any kind of experience unwanted sexual contact. From that same research in the United States, the result 70% to 31% female that have any kind of experience, while 7% to 16% of male will get the experience of unwanted sexual contact or physical contact before the age 18 years old. From that research, we can see male also have probability and experience of unwanted sexual contact when they are in a child. Okay, and then from the point of view pedophile, this is the research that taken away to male college student, which is 193 healthy male college student. 21% admit they have interest in sexual to the child, which is between 40 students. 9% male student, which is between 17 students, admit they would do sex if they guaranteed not being caught by the police. 9% also admit they have a sexual fantasy involving the child, and 5% male students admit they masturbate through their fantasy in their mind about to get sex with the child. Okay, I think that's all from me. Thank you.
Hi, my name is Nur Akila binti Mazlan. So today I want to talk to you about the prevalence of pedophilia in Malaysia. Do you know a total of 5,052 cases of sexual abuse involving children were reported in the past 5 years? The government is looking seriously into the problem of child sexual abuse and is closely related to pedophilia. Pedophilia is related to sexual abuse on children. Statistics for the past 5 years has shown an increase of such cases, except in 2014 and 2015, which recorded a slight decrease. Selangor and Kuala Lumpur were the states with the highest number of cases. According to media report quoting statistics by the Women, Family and Development Ministry, 22,134 children were sexually abused from 2010 to May 2016, which more than 50% of them raped. Statistics by the Malaysia River, there are a total of 1,721 cases of sexual crime against children recorded from January to June 30 this year by persons known the victim. Statistics from the police, there were 351 rape case, 344 molest case, 100C incest case, 100C unnatural sex case, and 514 cases under the Sexual Offense Against Children 2017. According to data furnished by the Drugs Police based in Malaysia in 2015, our country has the highest number of IP address uploading and downloading photograph and visual of child sexual abuse content in Southeast Asia. Although not all of the cases involve pedophilia, but sexual abuse cases show that the threat of pedophilia needs to be given attention. So, thank you for me. I pass to my friends.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Faizuddin bin Ahmad. Today I will present about cause of pedophilia. This is cause of pedophilia. First is have past history in sexual abuse. A history of childhood sexual abuse is another potential factor in the development of pedophilia. Though this has not been proven. Behavior learning models suggest that a child who is the victim or observer of inappropriate sexual behavior may become conditional to imitate this same behavior. This individual, deprived of normal social and sexual contact, may seek gratification through less socially acceptable means. The second, have a lot of many brothers. Okay. Individual may become aware of their sexual interest in children around the time of puberty. Pedophilia may be a lifelong condition, but pedophilic disorder include elements that can change over time, including distress, psychosocial impairment, and an individual tendency to act on against. Okay. Next is drug abuse and genetic. Okay, about genetic. Such studies suggest that the no or more neurological characteristic present at birth that cause of increase the likelihood of being pedophilic. Some studies have found that pedophiles are less cognitively impaired than non-pedophilic child molest. 2012 study reported that pedophilic child molest that defect in responsive inhibition, but not defective in memory or cognitive flexibility. Evidence of familial transmittability suggests but does not prove that a genetic factor or responsibility. That's all from me. Thank you.
Hi, Assalamualaikum. My name is Hana Salihah and today I want to talk about clinical manifestation for patients who are diagnosed with pedophilia. Clinical manifestation can be either objective when observed by a physician or become subjective when perceived by the patients, or we can call it as a symptom. Usually to diagnose patient with pedophilia, they must have had condition for 6 months or more. We look at the number 1. Pedophilic disorder is characterized by recurring, intense sexual arousing, fantasized, urge or behavior involving children that is usually ranged 13 years old or younger than that. Doctor diagnose pedophilia when people feel greatly distressed or become less able to function well because of their attraction to children or when they have act on their urge. Okay, the second one is the fantasized sexual urge or behavior cause significant distress or impairment in their social, occupational or other important areas of functioning. People feel greatly distressed or become less able to function well, either at work, in their family or in interaction with friends or social, or they have acted on their urge, like they usually don't have work or get terminated by the company, and all the family member don't like him. Okay, so for the number 3, pedophilia must age 16 years old or older than that, and 5 or more years older than the child who is become the object of the fantasize. An exception is an older adolescent like 18 or 19 years old who has an ongoing relationship with 12 or 13 years old child. Then, the diagnosis for pedophilia disorder should be specific whether the individual were attracted to children or not, the gender that the individual is attracted to, either boys or girl, and whether the sexual urge are limited to incest, like macam family members, father and daughter, older brother with the last child. When it talk about specific, pedophilia may be attracted to young boys, young girls, or both, and they may be attracted only to children or to children and adults. Okay, that's all for clinical manifestation for people who have a pedophilia.
As the diagnosis for pedophilia is specified based on their preference of attraction, there are 6 subcategories of pedophilia. Exclusive pedophilia, or known as the true pedophile, is when the patient attracted only to children under 13 years old. Okay, 2. Non-exclusive is when the pedophile experiences attraction and sexual drive for subjects over the age considered to be pathological. Okay, 3rd, differentiated. Differentiated is when adult is attracted exclusively to one sex. It's either male or female. 4th, undifferentiated is when adult is attracted indiscriminately to both sexes, male and female. Okay, 5, preferential is when the adult is attracted to both sexes but has a higher prevalence to one. It's either female or male. Okay, last one is incestuous pedophile is when the adult experiences attraction and drive exclusively or mainly for minor link by a family relationship. For example, is children, brothers, sisters, grandchildren, and or cousins.
Okay, hi, Assalamualaikum. My name is Mak Firdaus. Okay, now I will explain about treatment of pedophilia. It is a psychotherapy. We have 2. Cognitive behavioral therapy and behavioral intervention. Okay, for cognitive behavioral therapy or CBT aims to reduce attitude, belief, and behavior that may increase the likelihood of sexual offense against children. Its content varies widely between therapies, but a typical program might involve training in self-control, social competence, and empathy, and use cognitive restructuring to change a view on sex with children. Okay, the most common form of this therapy is relapse prevention, where the patient is taught to identify and respond to potential risk situation based on principle used for treating addiction. Alright, for behavioral intervention is to target sexual arousal to children, using satiations and evasion technique to suppress sexual arousal to children and convert sensation or masturbation reconditioning to increase sexual arousal to adult. Behavioral intervention treatment appear to have an effect of sexual arousal pattern during phalometry testing, but it is not known whether the effect represents change in sexual interest, or change in the ability to control genital arousal during testing, nor whether the effect varies in the long term. For the sex offender with mental disabilities, applied behavioral analysis has been used. Okay, so that's all from me about explanation of treatment. Okay, thank you.
Assalamualaikum and hi everyone. Now let me introduce myself. My name is Nur Syahidah binti Muhammad Ali. Today I would like to present about nursing care plan. Okay, first, nursing diagnosis of pedophilia is low self-esteem related to rejection by peers evident by not many friends. Then, the goals is patient will show high self-confidence. Next is nursing intervention. First is establish rapport that patient can give cooperation. Second is involve patient in psychotherapy that patient can confess their feelings. Third is encourage patient socialize that patient not feel lonely such as appreciated by their friends. Fourth is give psychoeducation to patient related to important lifestyle and appointments so that medication is adequate and symptom disease. Then is refer to Mentari for psychosocial rehabilitation so that patient can do activities such as handcraft, psychoeducation season and relaxation so that patient spend their time with beneficial things and avoid think about sexual. And lastly, administer tab fluoxetine 40 mg on night as prescribed by doctor to treat depression. After that is planning. First, patient will demonstrate behaviors that are appropriate and culturally acceptable for assigned gender. Second, patient will express satisfaction with own sexuality pattern. Third is patient will reduce their negative thoughts. And lastly, patient will interact with others using culturally acceptable behaviors. That's all from me. Thank you.
Assalamualaikum. My name is Siti Nur Zainah. In nursing care plan, I got the part of evaluation and effect to explain. What we got evaluation regarding pedophilia is patient was able to demonstrate behaviors that are appropriate and culturally acceptable for. Second, patient was able to express satisfaction with own sexuality pattern. Next, patient was able to reduce their negative thought. Last, patient was able to interact with others using culturally acceptable behaviors. Okay, this evaluation happened after nurse was planning what should to do towards patient. I mean, last evaluation, which is patient shows the positive effect in terms of behavior and thinking. What just I told before, that patient was able to reduce negative thought. Patient can interact as usually like others, which is acceptable to community. Okay, next effect. Here there are three effects. That is individual, which is victim, family, and community. Okay, what a victim face is, of course, who is a victim of pedophilia will be embraced based of confidence, trauma, and can lead to mental illness because this matter involves a person's dignity. Okay, next, family, effect family. After this happen, occur among children. So they will monitor child activities to avoid be a pedophilia victim. And the last one's effect to community, increase awareness about mental health so that people with problems how to get help and their therapy for rest of the mind. Next, increase screening in clinics, schools, government departments for yearly detection of disease can be referred to a specialist. And the last one is encourage experience health lifestyle such as socializing and exercise so that leisure time can spend with beneficial things. That's all from me. Thank you.
So, in conclusion, pedophilia is a chronic psychiatric disorder that is treatable perlu dirawat in terms of developing strategies for relapse prevention untuk mengelakkan daripada berulang kembali lah. So, treatment will be effective to the extent that it is comprehensive, specific and integrated with the criminal justice system whenever possible. So the treatment must be specific in that the clinicians should identify and address the precise problematic sexual behaviors. For those on parole or probation, there must be effective communication and collaboration between criminal justice and mental health professionals. So the untreated pedophilic behavior may harm the individuals, which is victims, and it may harm to the family and to the community. So that's all from us. Thank you for watching.